Assalamualaikum warahmatullahi taala wabarakatuh. My name is Waeil bin Shatir Anwar, 4th year student who is now majoring in medical physics in School of Physics, University Science Malaysia. Now, in this video, I will present you about the Fibroscan equipment that use elastographic principle. As we know, Fibroscan is a specialized ultrasound machine for your liver. It measures fibrosis, which is carrying and steatosis, fatty change in your liver. Fibroscan will help your healthcare provider learn more about your liver disease. It is also a unique patented device dedicated to liver elastography, and it's also designed to evaluate the state of the liver in a non-invasive and painless way. The examination is quick and easy, as the device can be operated by physicians or nurses. Previous experience in ultrasound is not required. Fibroscan can be operated on all patients who should be fast for at least 2 hours prior to their assessment. Fibroscan is also known as vibration control tension elastography, which is used in the context of chronic liver disease, since it enables the simultaneous measurement of 2 distinct quantitative parameters. The liver stiffness or elasticity expressed in kilopascal correlated to the amount of fibrosis in the liver. The control attenuation parameter or CAP expressed in decibels per meter. It is correlated to the amount of steatosis in the liver. Next, there are 3 steps of Fibroscan's examination. First one is the shear wave generation. Second one is the action of the probe ultrasonic transducer, and the third one is the calculation of shear wave speed and equivalent stiffness. So, the first one is the shear wave generation. The transducer in contact with the skin of the patient gives a mechanical impulse which generates a shear wave. The shear wave propagates through the subcutaneous tissue and then into the liver. Secondly is the action of the probe's ultrasonic transducer. In the meantime, the probe emits ultrasound waves which are used to follow the propagation of the shear wave. And lastly is the calculation of the shear wave speed and equivalent stiffness. An algorithm analyzes the return ultrasound waves and determines the shear wave speed in milliseconds, which is also known as V. The harder the tissue is, the faster the shear wave propagates, assuming that the liver is a pure elastic, linear and isotropic medium. Shear wave speed, which is V, is converted into equivalent stiffness in kPa. Next, we move to the examination procedure in the topic what could go wrong. These are the following signals that is right for Fibroscan analysis and the wrong signals ones. For the right one, it has the mode linear and uniform signals. For the wrong ones, it has the vessel wall structures. Secondly, it has a mode that is not linear, which is due to the lack of gel. And the third one, it has the heterogeneous structures. In conclusion, before measurement, the physicians or the doctors must ensure the optimal patient positioning. Next, they must control probe position with ultrasonic signal. Third one, they must control probe pressure, and lastly, they must control probe perpendicularity. After measurement, we must check the quality of shear wave maps and avoid read echoes, which are A and E waves. Inshallah, I hope all of you enjoy and understand my presentation about the Fibroscan analysis, which use the elastographic principle. Till we meet again, Assalamualaikum warahmatullahi wabarakatuh.